Okay, folks, I see where the meeting is now streaming live on Facebook. I'm Al Mattingly, the Daviess County Judge Executive. I always like to start the meeting with the mask on to remind you folks of how important it is to wear your mask. It's extremely important. Contrary to what some of my good friends have told you, masks do help prevent the spread of COVID. And if both people are wearing masks, it's even more effective. Wash your hands, sanitize your hands, social distance, avoid large crowds. Those are the things that we have in our toolbox. As a matter of fact, they're about the only things that we have in our toolbox to fight this disease. And we really have a growing issue within Daviess County and within our grad region. But before I go any further, let me wish all my friends out there who served in the military a happy Veterans Day and say thank you for your service. I know I was having coffee with my good friend Joe Terry this morning, socially distanced, by the way, and we were talking about the time that we spent in the military, particularly basic training at Fort Knox. I went in October and left Fort Knox in December, and Joe was coming in December. So our paths crossed. Another good friend, Army Armstrong, went through there at the same time. It was an experience, and it was an experience that I'm thankful that I had the opportunity to serve my country. So what we're seeing is a rapid increase in the number of cases of COVID in Daviess County and again in the grad region. Daviess County as of today, and these are the latest figures in Daviess County. Now, what I tell you may differ from what the governor tells you, but at some point, all the numbers will true up. But as of today, we have had 2,453 cases in Daviess County. Of those cases, 1,964 have recovered. Unfortunately, we've had 34 folks who have passed away from COVID. Currently, we have 7 people in the hospital. And as I like to do, by taking all those numbers into account, we actually have 455 active cases in Daviess County. I was talking to our guest, whom I'll introduce here in just a moment, that back in June, Daviess County was down to 25 cases, active cases. We have now grown that to 455. In the grad region, we've had a total of 6,228 cases. 80% of those cases have recovered, and we've had 107 folks who have died. One is too many. 107 account for moms and dads, and in some cases, young folks. It accounts for grandma and grandpa, great-grandmom, great-granddad. And while who knows how much longer they would have lived if they hadn't been infected by COVID, the fact is they would have lived some time longer and perhaps been around for the holidays. McLean County is a county in grad, and I chose McLean County because they're a small county. They have about 9,000 people there. And when you figure the number of cases in a county, you base it on 100,000 population, which means that McLean County, you have to multiply their cases by 11 to get the number of cases per 100,000. So McLean County has had 280 cases, but when you multiply that by 11, that's like having Daviess County having 3,080 cases. McLean County has had 9 folks who have lost their life to COVID. If you multiply 9 by 11, that's almost 100 folks. That's 99 people in a very small county. And small counties are just like Daviess County. We're all family, and they were our friends, our neighbors. They were relatives. And that's why it's extremely important for us to respect those folks who are around us. And out of respect, I wear my mask. Now, if you don't wear your mask, I'm not as protected. The mask will protect me somewhat, but it protects you even more. And as I said, when both wear your mask, that's about the best thing that we could do. I talk about McLean County because my good friend Kelly Thurman, the former judge executive of McLean County, is on with us today. I think that's his lovely wife Sharon in there. And the reason I asked them to come on is that several weeks ago, I found out that Kelly and his wife both had experienced COVID. And I wanted to have someone here who had an experience with COVID, and in some cases, a very bad experience with COVID. And I want them to kind of tell their story to the folks who are watching. And by the way, if you have any questions during this, if you'll just text them or send them to the Facebook page, they will get redirected to me. If I can answer them, I will. If not, then I will be happy to get the answer and let you know. So Judge Thurman and Sharon, welcome today. It's nice to see you. It's always nice to see that smile, Kelly. You've always had a smile, never a frown. Sometimes you've seen me get mad as the Dickens, but you've always had the smile. And Sharon, I think that's because you were his sidekick and his mate. So Kelly, tell us your story.
Well, Judge, thank you for the opportunity to be with you today on this very important topic. Before I move on, though, I would like to echo what you said concerning our veterans and thank them for our service. Thank you for your service. And I hope everyone will take a moment out of their day-to-day to reflect upon the freedoms that we have because of the service that these people have given over the years. Our COVID story began roughly a month ago. Sharon and I had made a decision when all of this, 2 months ago. That's how it goes. That's why I've got her here to verify. Early on, when COVID appeared in March, we knew that because of Sharon's past health history, that she was going to be very susceptible to this. And I'm just going to be very blunt. We looked at each other and said, if you get this, Sharon, this could kill you. And we recognized that immediately. And we began to make every effort we could to distance ourselves from the possibility of getting COVID. We did not go anywhere beyond, I'd make a trip to the grocery store. I farm, as you know, and I was out doing my farm work, but again, isolated most of the time from people, and I felt pretty good about things. And we made it through the summer, and we watched and we kept up with what was going on, and we tried to apply all of the practices to our lives that we possibly could to avoid COVID. And one week, as she says, about 2 months ago now, I began to feel kind of drab and just kind of drug out. And quite honestly, I thought it was kind of a cold that I've been known to get this time of year, just being out in the cooler weather one day, the hot weather the next, and back to the cool. And I didn't give it a lot of thought. Just felt kind of rough, and ran a temperature for 2-3 days. Nothing severe, but just enough that I just didn't feel like I had any energy. I likened it into driving a 4-wheel drive pickup straight up a mountain with 4 flat tires. Just no way I was going to accomplish that. This went on for about a week. And like most people, most hard-headed people like I am, I kept thinking, well, I'm getting better. I'm getting better. And a week into it, I wasn't a lot better. So I called my doctor, and we did a telehealth conference, and I told her what my symptoms were and what was going on. And she honestly did not think that I had COVID. But she felt like that probably would not do me much good to get a test that far into it. It is basically, and with all due respect to her, she just basically said, you're going to have to tough it out and move on. And I took her advice, and we did. And so over the weekend, I just didn't improve at all. And along about Tuesday, Sharon began to kind of feel puny as well. So we decided that, we don't know what we're dealing with here. Maybe we ought to get a test to at least know where we need to position ourselves in terms of being out and about at all, away from people, totally isolated. What do we need to do? So we went and got tested. And that was on Tuesday. And on Thursday morning, they called with those tests, and we had both tested positive. And the protocol, as you know, was to quarantine for 14 days. And at the end of that period, we should be clear of the virus at that point. So we began our quarantine. 2 days later, Sharon got up that morning and she made a statement to me. She said, "I just don't feel very well at all." And I love her to death, but I'm going to say this to put it in perspective. With her other issues, me hearing that she doesn't feel very well in the morning didn't really shake me up too bad, because it was just typical. And we stirred about a little bit, and I came into our kitchen area and she wasn't there, which I thought was extremely unusual. And I looked over and she was in a recliner trying to get comfortable and trying to rest. She was out of it. So I tried to fix her a little bite of breakfast to eat, and she hardly touched it. And she tried to sleep and she just could not get comfortable. Finally, she did. And she slept for close to 3 hours. And along around noon, I decided, she needs to get up and stir a little bit, perhaps go to the restroom, perhaps let's try to eat a little something. So I woke her and said that to her, that's what we need to do. And she agreed. She's very weak, but she agreed. And we have one of those pulsometers that you put on your finger to measure your oxygen level and your pulse rate. And I took that and I put it on, and she had been typically running in the low 90s on oxygen level. When I read it this time, it was 50. But she was trying to get up, and she has a lift chair because of her arthritis condition. And she raised the lift chair up. And if you've ever sat in one of those, you know that as you raise, there comes a point where you've got to make a decision about hanging on to that chair or stepping up and moving on. And she was at that point, and her eyes were just glazed, and she was frozen, holding on to the arms of that chair. And I kind of had to shake her a little to remind her what we were doing. And she said, okay. So we made our way on back into the bedroom and to the bathroom, and coming back, we passed our bed, and she told me, she said, "I've gone as far as I can." And she just collapsed on our bed. And I made her comfortable as I could, but I'd been watching her before she got up out of that chair, and I could just literally see she was decaying right there. It was going downhill, and there was no struggle at all for breath. No indication that she couldn't get her breath. She wasn't saying, "I can't breathe, or I'm having trouble." It was like watching air sift out of a balloon. It just little at a time, and just kept sinking. So I told her, I said, "I'm losing you here." And I said, "I'm fixing to call an ambulance." So McLean County Ambulance Service came, got her on oxygen, got her to Owensboro Health, and she spent the next 15 days at Owensboro Health. And I'm going to let her take the story from there and kind of tell you what she experienced.
But before you go, and Sharon, let me interrupt you before you go. So, Kelly, your symptoms, a little bit of fever, just kind of felt tired, a little run down. but that was about it. Sharon, your symptoms?
He did have a little cough.
Okay. Okay.
But he never lost taste or smell
Right.
like say you do, which is why he thought he just had a little cold.
Headache? Did you have a headache?
An occasional one, but not anything that really struck me. I just
Right. Nothing out of the ordinary.
no, I just thought, it was a light flu or a light cold,
Yeah.
and just no energy at all. But once I got over the apex of it, I came out of it pretty quickly. My only symptom I would share with you, the only thing that I continue to experience, even to this day, is from time to time, no matter what I'm doing, I can sense that I'm having some shortness of breath in my chest. And I experience it to the point that I know I got to sit down and take a break and reload. And it generally takes 10 to 15 minutes, and then I'm good to go again. And sometimes this happens once a day, sometimes it happens 3 times a day. There's no rhyme or reason to it. But beyond that, I'm doing pretty well.
Okay, good. Well, Sharon, so we're riding in an ambulance. We're getting you to the hospital. Take it from there. Tell us what went on.
So the symptoms that I had before I left was fever.
Okay.
And again, I didn't really experience shortness of breath, but my pulsometer showed that, every day it was getting a little lower. And I don't remember much about the ambulance ride. I guess we probably waited a couple of days longer than we should have.
I think you and Kelly share a little bit of that hard-headedness, if I kind of.
Maybe, yes, maybe. But I will say that getting oxygen on me did help revive me enough that when I got to the hospital, I was able to talk to them. Good. The Onsborough Hospital the emergency department did a wonderful job. Got x-rays quickly, and the doctor came in and said they had called Dr. Missouri, who is the pulmonologist assigned to all the COVID patients, and that he was a good doctor and would take good care of me. He told me that I did have pneumonia in my lungs and that I was going to be treated. Said Dr. Missouri will get you plasma, remdesivir, dexamethasone, and he said we'll take good care of you, and they did.
So the one of the results of COVID is that you develop pneumonia.
Some people do, and some people don't. And that's one of the things I've learned is it does hit. I mean, there are a few common things, but it does hit people differently based on the circumstances that you have. I have rheumatoid arthritis that has attacked my heart and my lungs, so I have issues there. And I've had to have a lot of surgeries. So, that wears on you. I've never had pneumonia before, so that was something completely new. But again, getting oxygen helped. And I don't remember much about the first few days of being in the intensive care, other than I kept saying, are you going to have to put me on a ventilator? Mm-hmm. And they said, we don't think so, but they did put me on a BiPAP. It is a horrifying experience. I have never been a person who panics. I'm usually pretty calm. I was a teacher in middle school, so I'm usually a pretty calm person, but that panicked me. I felt like I was going to suffocate. Hey,
let me say thank you for your service in middle school. Those kids who are starting to develop all those hormones can be worse than other folks sometimes.
I liked the kids most days.
Yeah.
To get through the BiPAP, they had to give me not a sedative, but it's a medicine they give you when you're depressed. Anyway, they had to give me something to calm me down, which again, I've never had to do. And I had to have that BiPAP for several days. in addition to the oxygen. But once they got the plasma in me, which is, an IV done in a couple doses, I take an RA medication that the pulmonologist said there's some research about it helping RA patients with COVID called Xeljanz. And he had Kelly bring that to the hospital. And once they got all those medicines in me, in addition to my Xeljanz, the things I told you, I began to feel better. And I feel very blessed. I feel like that we always thought it would kill me. And I feel very blessed that I did respond to all those treatments. And I think part of that is prayers. We had a lot of prayers. I had to stay in intensive care for 9 days because every time I got up off the bed, which I could only do with help, COVID makes you as weak as if weaker than any surgery I'd ever had made me. So I had to have help. But every time I stood up off the bed, my oxygen drops. And so I had to get past that to be able to move onto the COVID floor. And then I was moved to the COVID floor and spent the rest of the 15 days there. I will tell you, it is probably the loneliest place I've ever been. There is a machine that runs constantly that's cleaning the air. So in addition to the things you have in the hospital that are beeping and the heart monitors and those things, you've got that air sound running constantly. Only the nurse and the nurse assistants come into the room, and they have to take 5 to 10 minutes to put on all of the gear to be able to come into the room. The doctors didn't come in the room. They took reports from the nurses and all of the tests that were being run. They would wave at me through the window. So
Kelly, could Kelly visit you while you were there?
No, but
No,
let me say this while we're at that point. I could not have asked for better service and communication from the hospital. I know that in your role as judge executive, and when I was in office, we always would you tend to hear all the negatives about an institution like a hospital. And I know everybody's got an opinion, but they were top notch. Someone on that nursing unit called me daily, almost to the minute every day, with an update on how she was doing, what the expectations were, and what I should anticipate. But I couldn't go. In fact, I was still quarantined.
Okay.
But my sister-in-law and her husband came and took, for instance, the medicine that she was speaking of. They took that and took it to the door of the hospital, and then the hospital took it from there. But I never saw her until the day she was discharged. I could never go in the building.
Well, Sharon, I know.
And they were covered in so much gear that I would not recognize a single one of them.
Well, I know what you said about prayers has to be true, because when I found out about it, I talked with Kelly. Judy and I were praying for both you and Kelly that you make a full recovery. Now, I know that both of you are still struggling, as Kelly said, a little bit with some of the residual symptoms that he has. Sharon, are you having any issues beyond the initial infection?
Yes, I'm in my 9th week, if you count the very first day that I realized I wasn't feeling well. I'm on oxygen and will be for at least 3 more weeks until I go, and they're going to do an oxygen study to see if I'm ready to get off of the oxygen. That's very limiting to be on oxygen.
Yeah.
And I'm still very weak. I have to use a walker. And some days I'm not sure I can do very well with my walker. The COVID, the pulmonologist told me, attacks your neuromuscular system, not for everybody, but for a lot of people. And because I have rheumatoid arthritis, it seems to have particularly struck me in those areas. And so I'm in a great deal of pain. I started physical therapy last week to hopefully help me alleviate some of that pain and to help me get stronger so that I can walk again and try to get back to some semblance of normalcy. But the doctor has told me that that could take at least 3 more months.
Okay. Kelly, I don't know that any of us ever thought you were particularly normal, but I'm not aware of any health issues, particular health issues that you may have had.
No, I've been very blessed through life.
You have diabetes,
I am a diabetic,
but
Okay.
not bad, just a
Right.
pill.
I can
Okay.
cheat a little, but
Yeah.
I've
Type,
been
type 2 diabetes. Yeah, type 2, I guess. So, well, you know, we hear from people who say only sick people who are already sick get COVID. Well, that's not the case. I don't think, while both of you had some issues, I don't think that you were the types of folks that they're talking about. You know, and have you got anything else you'd like to talk to us about, or I'm going to kind of wrap it up?
a couple of things if I can. When I first got this, I had been watching my P's and Q's about where I'd been, what I'd been doing. And the previous 2 weeks before I began to feel bad, I had had a total of 6 contacts in that 2 weeks. I contacted all 6 of those people. No complications, nothing that we could really link to it. So you can get this without even knowing it. I still struggle with forgiving myself for ever bringing it into the house to my wife. But all I can say is be careful. Wear the darn mask. I don't like it either, but it's the simplest thing we can do right now to try to stop this spread. And on the backside of this, I want to share, just so people will be aware of this. After experiencing COVID, many of us develop antibodies to fight COVID off. And as Sharon mentioned about the plasma really making a difference in her life, I went and was tested to see if I had sufficient antibody levels to give plasma. Mm-hmm. And I do. And I gave about 3 weeks ago, and it's exactly like just giving a donation of blood. You feel really no other discomfort. The only real difference, it takes longer. It takes about 45 minutes to an hour. And as we were finishing up, the nurse had drawn 4, I guess they're 200 milliliter bags like you see on an IV machine. And I made the comment, I said, now, is that enough to treat one person? She said, oh no. She said, this will treat 3 and in some cases 4 people. Oh. And that just struck me, Al, that I could do something to affect 4 people. Well, and I in this week. And my message is, if you're carrying the antibody and healthy enough to do so, go get yourself tested and try to do something to fight the war locally here on this, because they desperately need that plasma.
Well, Kelly, I know what kind of servant leader you were as judge executive. I know you still have that same servant leader quality in your heart, and you didn't do anything I wouldn't have expected you to do. So thank you for that. I also want to say thanks to both you and Sharon for coming on, and hopefully if we can just change, if we can convince just one person to wear a mask, that's one person who will be protecting themselves and potentially their family. Right now, as I said, we were reported with 64 cases today at Daviess County. Couple hot spots are in some personal care homes for people. But Clay Horton, the district health department CEO, said that most of the cases that we're seeing now are coming from families where there are multiple cases, 2, 3, 4 cases in the same household. Now, there really isn't a good cure, a single drug that you can take. As Sharon talked about, they gave her a combination of various drugs plus the plasma, which had the antibodies in it. Until we get an effective vaccine, and praise God that Pfizer's vaccine is as good as they say, 90% effective, and we can get it out. But just understand that vaccine is not going to be available for all the people that need it probably till the middle of next year. So we are faced with a long, hard winter. And the only things that we have, folks, the only things, this mask, washing your hands, social distancing, and avoiding crowds. And if you do that, I can't guarantee you that you won't get COVID. Kelly and Sharon did everything that they could to avoid it, but you will minimize the risk. You still can get it, but you'll minimize the risk. So with that, Kelly, Sharon, thank you for being with us. Thank you for sharing your story. Folks, we'll be on the air same time next week, and we'll give you another update about COVID in Daviess County and in the Grad region. Thanks, everybody.
Thank you.